We are seeing an uptick in the COVID cases. Is it a worrisome situation? What is really JN.1 all about? What are the symptoms? What are the precautions that one can take? To answer all these questions, I am joined by the former chief scientist of World Health Organization, Dr. Soumya Swaminathan. Thank you, ma'am, for joining with us and giving your time to us. I want to start by asking you, when we talk about JN.1, the subvariant of Omicron, that is in fact doing the rounds in US and Europe, we are seeing that the numbers are increasing. What is really the situation in India? Because right now we have detected cases in Kerala, Goa, and Maharashtra. So what is really the impact that we are seeing in India at the moment?
So I think globally there is an increase in COVID infection in many countries, and this coincides with the winter season in the northern hemisphere, when respiratory infections generally go up. So it's not just COVID. There's a lot of influenza that's circulating. There's RSV. There are also some bacterial infections. And what's happening in Europe, for example, is that children were getting the infection in school and then coming home and bringing it to their parents. So it's a mix of respiratory infections. However, this particular subvariant, JN1, which is a subvariant of the Omicron family, which has now been classified as an independent variant of interest. That means the WHO thinks that there's something unique about this. It has some mutations which make it more transmissible. And so that's why it's got this variant of interest, which is separate from its parent virus variant. So, so globally, it's gone from being about 3% of samples a few weeks ago to now being about 30% of all circulating COVID variants. And it is predicted that in the next week or so, it'll be the dominant global variant, which means that it has an advantage. It's being able to spread faster, better than, more efficiently than the previous variants. Now in India, there's still very limited data because the testing was quite limited in most states. It's very low. And also the genomic sequencing also was not, being done in large numbers. So this is why we have a few scattered reports from some states. But I think now all states are picking up both testing as well as genomic surveillance. So in the next week or so, I think we'll get much better information. It's clear that there is an increase in cases in India as well, COVID cases. Many states are seeing increased numbers. But at the moment, we don't fully know how much is JN1. And also, there does not seem to be any increased, sudden increase in hospitalizations or deaths so far, which is a good sign.
All right. When we talk about JN.1, what do we know about the symptoms? Because right now, like you mentioned, when it is winters, there are also influenza-like illness. There are also severe acute respiratory illness as well. So how do one differentiate between the symptoms? Is one suffering from the influenza-like illness or JN.1 or COVID?
It's quite difficult to distinguish because, have very similar. So fever, and then some of them go on to develop breathing difficulty and pneumonia. This can happen with other viral infections also, like influenza. So the only real way to distinguish is by testing, not by symptoms. It's very hard. So I think that's why we're saying we need to step up testing, at least in those people who seem to have quite severe symptoms.
But when we talk about the symptoms, is there anything unique with the symptoms, or is it similar to the one that we faced with Delta or Omicron variant?
Right. There's nothing unique. It's similar symptoms.
All right.
And it's not only similar to previous variants, similar to other respiratory infections as well.
All right. All right. When we talk about the vaccines, the existing one in India, do you think that they are well equipped when we talk about the vaccines, or do we need to go back and do a research? Do we need to come up with new vaccine? Also, I want to ask you about the booster dose. Is there a new need for booster dose, the second booster dose? Do you think that that situation has come to?
Those are all good questions, and we need data to answer those questions. As far as the vaccines that were used in India, they seem to be holding out quite well in terms of protection against severe disease and death. And these were, of course, the original vaccines that were made. Subsequently, many companies started making vaccines out of the um, uh, variants that were emerging later.
Mm.
So the
Yes.
XBB 1.5, for example, was used by
Mm.
many companies. And so in Europe and the US, you find that these modified or updated vaccines are now being used as boosters. In India,
Mm.
we have not had a program after the first, thing was completed, the third dose. And so far, like I said, the immunity seems to be holding out. What we really need to be paying attention to now is that if hospitalizations increase, we need to look at the profile of those people. What is their age and sex and underlying other comorbidities, but also when did they have their last shot of vaccine, what was the
Mm.
vaccine that was used, and if possible, some research can be done, uh, taking a blood sample to see what level of immunity is still there. It's only through such type of observations, clinical observations and immunological studies, that we will understand about the long lasting nature of the protection and whether certain specific groups might need a booster. We had, the WHO has not recommended that people should get regular boosters after every year or something, though some
Yes.
countries are doing that.
Mm.
But for that, we need our own data on our own
Mm.
population to know whether boosters will be needed, if so, how frequently, and for which age groups.
All right. Just two more questions. One is that right now the official statement by the Health Ministry says that there are 21 cases of JN.1 and the majority of it is coming from Goa. We know Goa is a tourist place. For Christmas, for New Year, it is festival season. There is going to be overcrowding. Do you think that this is the time that we need to bring in the restrictions, some sort of restrictions, mask or some rules that needs to be put in place right now?
So I think, now we're in a situation where we understand how this virus gets transmitted. Everybody knows. And people also know how to protect themselves and how to protect others. So it's a good practice to take sensible precautions. For example, if you're going to be in a big party with a lot of people in a closed environment,
Mm.
without good ventilation, then I think wearing a mask, either if you need to protect yourself, if you're older, above 65, if you have some underlying illnesses, or if you yourself are sick, if you're having a cough and cold, then it's
Mm.
really a good idea to wear a mask so that you're not spreading it to others, So both ways masking helps, and particularly in these kind of closed, crowded settings. I think that probably it's there is no reason right now to impose any kind of public restrictions, bans, etc., because I don't think we're in that kind of a situation where we things are going out of control. But I think that this is the time to watch very carefully. The government is going to be watching carefully, is going to be reviewing the data on a daily basis, and will escalate
Mm.
restrictions and bring in place new rules if it is necessary. So for now, I think public should take the precautions that we know
Mm.
that it spreads through close contact, it is airborne, and if you're in a prolonged close contact with a group of people, if one person is infected, it can spread to a few other people. So I think it's, especially as you mentioned, it's the time for a lot of large gatherings and parties.
Yes.
Outdoor would be much better than indoors, but if you're indoors, then you have to really assess your own risk and decide that you want to be careful. Because as I was saying yesterday to another channel, COVID is not like a common cold. It does give you long COVID. It does leave your
Mm.
body with certain long-term complications on the heart, on the brain, etc. So it's always much better to prevent yourself from getting infected again than from suffering later.
Ma'am, you mentioned that how it is, JN.1 has been classified as variant of interest by WHO. Do you think that eventually it might lead to hospitalization in India, though the cases as of now are less? But do you think that eventually it could lead to hospitalization and we need to be gearing up for the situation?
Absolutely. So hospitalization is a function of numbers. There will
Mm.
always be a certain percentage of people who get sick. If you have 100 people, maybe one is hospitalized. If you have 10,000 people who get the infection, 100 will be hospitalized. And
Yes.
therefore, the hospital burden could go up very rapidly, if
Mm.
this really starts spreading in the community. And this is why the government has asked all states to be prepared to run mock drills to make sure that their oxygen, ventilators, beds are all functional, that the supplies are there, that personal protective equipment is there, that masking is followed at least within hospital settings. So I think those are very significant and important guidelines that the government has given, and it's reviewing with all the states on a regular basis. So we need to be prepared. It could or it may not happen, but if it happens and we're unprepared, then it's not good. Having learned from all the past and really having ramped up our capacity across the country, this is the time to make sure that all of that is working, it's in good condition, that people are trained and that they can use it if needed.
Ma'am, before I let you go, you just mentioned that COVID is not a common cold. But now, do you think that we need to be, mentally tell ourselves that this is not ending and this is going to keep coming back and this is not just a common cold anymore? This is something that might just keep happening every now and then.
Exactly. It will keep happening because I think, in the history of viruses, this is still a very young virus. It's only been with human beings for 4 years. Influenza has been with us for hundreds, maybe perhaps thousands of years. It has evolved to the point where we know what to expect and we learn to live with it. And, we haven't reached that point with COVID. There are still surprises that could come.
Yes.
That is why the surveillance, the monitoring, the preparedness, all of that is very important. It also prepares us for other viruses that could suddenly emerge. And therefore, this whole concept of pandemic preparedness, includes COVID and how we deal with new variants and new surges, but also with the threat of emerging viruses, that could come at any time. And it doesn't have to be the coronavirus, it could be some other virus. So I think this is what the pandemic has taught us. We have to be prepared because we don't know exactly when the next situation is going to arise. And so we don't want to panic people, but at the same time, I think the preparedness will help us to deal with the situation and to minimize the loss of lives. I think that really is the goal.
Thank you, Dr. Soumya, to actually alerting us and telling us what precautions we can take on ground, and also telling us the difference that it is not a common cold anymore. COVID needs to be taken very seriously. Thank you for joining us.
Thank you very much.